Small business owners scrambling over the high cost of Obamacare, even if they have less than 50 employees. They are among the millions of Americans receiving cancellation notices in the mail. Americans like our next guest, who says his small business plan, it's getting the axe. Joining me now, Doug Flynn, co-founder of Flynn Zito Capital Management. Doug, great to have you on the show.
Great to be here.
Tell me about the plan you had in place or have in place currently that you're going to lose.
Yeah, it covers everybody. We cover the entire single-person part of the plan, and it meets our needs very well for the whole staff.
So you only have 9 employees. You're doing the right thing. You're giving your employees coverage, right?
Yeah.
And then one day on the telephone, the insurer tells you what?
So what happens is really only 2 major providers in our area, and the one is completely vacating the industry at the end of the year. So January 1, they're out. We get actually till our renewal date, which is June 1st. So I have until then, actually, through May, to figure out what we're going to do. But I went on to look at what the options are, and they're significantly more expensive.
Now, why do you think this is connected to Obamacare?
Well, I mean, you would normally get an annual increase that within reason. You know, maybe it was 15 or 16% would be like a normal increase in our area. Wow. So you kind of expect that as a small business owner. But, you know, we offer a full suite of benefits for our employees, and there's only so much money to go around. So you have to say, well, now we're faced with decisions on whether or not these increases are you know, 33%, or if we're going to cut coverage, they're going to end up with paying out of pocket or having to go in for co-pays or something like that. So we have to decide, do we cut back on other benefits to give them this?
All right. Well, what did this insurer tell you about why they did this? Did they give you an explanation?
Well, actually, what happened was the only people who've gotten notices are people that are renewing in the first quarter. We're actually in the second quarter, but because we deal with a lot of small businesses, our insurance person said, hey, listen, this is what's coming down the pike. The people in the second, third, and fourth quarter renewals don't even know yet that they're going to get punted. So a lot of the stuff that's going on, a lot of the things that you hear, people don't even realize that they're going to be faced with this very shortly. We just happen to know it's coming.
You just happen to be around the corner, on the curve, because of what you do for a living.
That's right.
Advising people. So let's talk a little bit about, do you put your employees into the Obamacare plan? I mean, is that what you're going to do? You're going to have them sign up on the website?
I mean, I don't know what we're going to do, to be honest with you. I think that's part of the problem is that
there are no options.
There are some options on there that you can look at, but they're all either for the same money, significantly worse in benefit, or significantly more in money that has to come out of someone's pocket. And if it comes out of the employee's pocket, how am I going to have them come to work and have to take a family plan is going to be over $2,000 a month.
Ow.
So, I mean, it's already significantly expensive, but at what point is it almost not worth going to work?
I want to show these numbers that you gave to our producers. These are Obamacare costs to your company. The Gold plan, that would be a 15% increase, is that right?
That's right. And the Gold plan, that's the one that they now have out-of-pocket expenses, 20% co-insurance. So we have an increase of 15%, and everybody's got to pay 20% of everything out of pocket. Or if they want to pay the Platinum plan, which is $733, it's a 33% increase, then it's most closely to what we have right now. But, you know, where is that money going to come from? It's not any cheaper. It's not the same. All those things that they were telling us that were, I expected some increase, but not this much. And we just have to figure out where is the money going to come from. We're going to make the employees pay for it.
You're a tiny little company, and you're going to have to absorb this in some way. If you could tell lawmakers in Washington one thing, what would it be?
Yeah, well, you know, what I would have said had they asked me was I would have told them how to roll it out a little bit better than the way that they did it, or had beta tested it. All the things that a business would do when they're doing something this major, roll it out state by state.
Give it to the private sector.
You know,
let them do it.
Yeah, I would have loved to have just competed and bought something from across state lines that would have been a little bit, you know, I could have competed for that. I can make my own decisions. I just didn't get that opportunity.
Well, I think that's what has got a lot of people frustrated. We seem to be being told, it's good for you, take it.
Right.
And don't ask questions.
And here's what you're going to pay for it.
Exactly. Doug, thanks for coming on today. Appreciate your time. Well, now we want to know what you think. Here's our question tonight. Who do you blame for losing your health care plan, Obamacare or the insurance companies? Log on to GerriWillis.com. Vote on the right-hand side of the screen. I'll share the results at the end of tonight's show. We've got more coming up, how the Fed's policy of low interest rates could be hurting your pocketbook when it comes to insurance. And still ahead, more mortgage lenders are offering loans well below 20%. I'm talking 5% down payments in some cases.